Hey, this is the Queen, host of the Home Health Queen High Tea Show, broadcasting live each week on Saturday at 11 a.m. Central Time from the Fishbowl Radio Network studios in Bedford, Texas. Log on to hear all things home care and home health. Listen in to get all the tea because I'm going to bring it to you, whether it's home health, hospice, assisted living, and much more. So be sure to log on each week on Saturdays at 11 a.m. Central Time. Catch the Queen on the Home Health Queen High Tea Show. Peace. Good morning. What's going on?
Good
What's
morning.
going on? Good morning, Mr. Derek J.
Good morning. How are you?
I'm doing well,
the
thank
Queen.
you. I am that. Hey, I want to say, first off, guys, welcome to the Home Health Queen High Tea Show, where we come in and we talk all things home health, home care, assisted living facilities, boarding homes, and much more. Y'all got me for about 47 minutes this morning, so I'm going to jump right in. But before we do that, Derek J., y'all know my mama called that boy Money Green. Money Green, before we start this segment, I have to give a shout out and I have to say thank you to everybody that has been tuning in to our podcast show.
Yes.
You know, I feel as though this is our 5th show. And I feel as though we popping it. And let me tell you, I don't feel it, I know it. Because, see, the studio done gave us our little analytics. And they done told Queen, you doing it. So for that, I have to say, United States, USA was number one of course. Y'all, we had over almost 6,000 viewers on that first show. United Kingdom was second. So United Kingdom, I want to say thank you for rocking with the Queen. I got much more to give. Keep rocking, and I will make sure that you are becoming educated and elevated within this industry. We had people coming in from China. China, thank you. We had people from all over Mexico. So
even Russia.
We did. Right. And let me tell y'all, Russia, I was looking sideways. I said, who's trying to watch me? But thank you to Russia. I appreciate you.
Yes.
And of course, I always appreciate all my Tickety Talk people, my Facebook people. But Derek, we got to get back into it because time is of the essence when we get on this podcast show.
Definitely.
But I definitely wanted to say thank you. How was your week?
It was good. A busy week. I had to travel a little bit this week. But Queen, I mean, you've been watching the news, this whole United Healthcare thing. Like, they caught the guy, I guess, the suspect.
They did. And, you know, I've had a couple of questions about that. And, guys, I want to say this. First off, I want to say my prayers are with the family of the victim. This is the thing, you know, that's good that you brought that up. And that's going to kick off this segment because today's segment, Derek, we are talking about how to diversify your agencies and or assisted living facilities within this industry through credentialing. Because, see, United Healthcare, Blue Cross Blue Shield, Aetna, Molina Healthcare of Texas, and wherever you are, there are MCOs within your state, right? And a lot of newly licensed agencies, along with my seasoned agencies, you're afraid to take that step out and deal with MCOs. And for the people that don't know, guys, MCOs is managed care organizations. And when we hear that word, that just means insurance companies. And if you want to go deeper into it, managed care, guys, everybody has insurance, whether it's through your employer, whether it's self-funded, or whether it's federally through and or state through Medicare and or Medicaid. So I'm about to break it down, so get your pens and paper together because I want y'all to fully understand what a true MCO is when it comes down to our industry as being a licensed agency and or assisted living facility, Derek, because a lot of people don't even know what they do. Guys, MCOs is just what the title is. It's managing the care of people, okay? So that MCOs, if you are a Medicare and or Medicaid provider, you are a licensed provider, whether it's home care, home health, assisted living, behavioral health, you are a provider in this industry, you have the opportunity to credential to become what's called an in-network provider with these MCOs, right? And if you have the proper credentials to get into these networks, they will pay you to take care of the people that are underneath their bracket. Okay, so basically, these MCOs is basically going to pay us for our services, but in order for them to do so, you need to be contracted with them unless it's a PPO plan. And guys, I know everybody have kind of heard about HMOs versus PPOs. And even if you are a PPO member, that means basically you have the opportunity to go out of network to a provider that doesn't have a contract within that particular group, and most of the time your benefits will pay that out of network provider. So it's very good to become in network so we don't have to worry about if the patients have out of network benefits. You follow me?
I hear you. Queen.
I'm trying to keep it real simple because I want to get down a little bit deeper, because as a licensed home health, home care, ALF, behavioral health, we all have to have these proper credentials in order to become in network. Okay. A lot of people always contact my firm, Priority Consulting, and they want to be credentialed because, see, back in the day when I started way back when, nobody wanted to deal with MCOs because there's a misconception. You know, these people on ticketed time. I'm finna get a little shady. You know, I like to keep people attention. Everybody tells you, oh, I don't want to deal with Medicaid. They don't pay enough. Oh, I don't want to deal with the MCO. Oh, they don't pay enough. Well, you know what? I beg to differ. Because, see, I've been in this industry over 20 plus years. And what I've learned is everything dries out eventually. So if the MCO, if you're in network, somebody told me one day, Queen, it don't even make sense for me to credential with Blue Cross Blue Shield because they only paying me $85 per skilled nurse visit, but I got to pay my nurse. And I looked at them and I said, okay, let's do the math. I got to calculate out. I said, see, here's why I will take that Blue Cross Blue Shield patient and you won't. Because one, I'm in network. And two, $85 per visit. See, that may not sound like a lot of money to you guys, but if you really a licensed, you in the game, I tell y'all, don't play home health, be home health. Play the numbers game. You got to know how to properly pay your staff within the industry so when the insurance companies pay you, it makes sense financially because you're going to make your money on the back end through quantity of patients and visits, Derek, right? So if you think about quantity of patients and visits and you stack them, so the ones that you won't take, send them to Priority because I'm going to take them and I'm going to have me 15 to 20 that's paying me $85 a visit. And just to let you know, in my region, I pay my nurses between $35 and $40 a visit for an LVN follow-up, and my RN gets $100. So you always going to be at a loss on that first visit. But see, I'm going to get my profit margin up on my subsequent visits. Y'all got me? Y'all following me?
We hear you, Queen.
All right, now look, tell the people, because we need to tell the people about calling in.
Yeah, and Facebook, Instagram, TikTok, I'm watching you right here. So if you have questions, you can leave it on the streams, or you can call in at 214-556-6239. And also, don't forget to also check out Fishbowl Radio Network. Their website is fbrn.us. So, yeah, we're on all social media platforms. We want to hear from you.
Yep. And guys, like again, today we talk, if you're just joining me, we are talking about all things credentialing within this industry. Now, the first thing that people want to know is, Queen, how do I get my agency in network with these insurance companies? Guys, it's not rocket science, but you have to know the proper ways to credential. We're going into the basics. So if you are first off, you got to have a license, whether it's home care and or home health. In your state, what I want you to do, if you are a non-medical agency, go to your Medicaid state site. In Texas, it's called Texas Healthcare Partnership, Medicaid Partnership, it's TMHP. Every state has their own Medicaid program. So it's so simple, Derek. All these people got to do is Google it. Google my Medicaid in my state. And you're going to find out that's website, because I want you to do that because Medicaid has certain programs for our industry. And on that Medicaid's website, guys, I want you to look for all the Medicaid MCOs. We call them Medicaid Advantage plans. It's going to give you a list of your MCOs in Texas. And I talk Texas because I'm sitting in Texas. Y'all know I'm a Texas-based agency owner. I'm a Texas-based healthcare consultant. So I'm going to talk Texas. But if you, whatever parts of the country you're tuning into, Google your Medicaid's program if you have one in your country. Okay? And once you do that, get the list for the Medicaid Advantage plans. And if you're a Medicare certified agency, do the same on Medicare, CMS.gov. So you will have all the insurance companies that will pay you for our types of services. Non-medical, y'all, I'm always preaching, Derek, you limited. But you will have some. In the state of Texas, non-medical, Molina Healthcare of Texas, Superior, United Healthcare Community Care Plan, Community Health Choice in Houston. Okay, these are Medicaid Advantage plans that pays for non-medical. Most MCOs will pay you on the skills side to provide the services that you have. First step. Everybody think when you go to these insurance companies, there's always something called a providers tab. You click that tab, and y'all gonna see a button that says request to join network. They call me all the time, Queen, I click the button and I put in my agency information, but I haven't heard back. And or you get a denial letter within 48 to 72 hours. Guys, it's a proper way to credential. That's not it. Most insurance companies want you to notify them that you would like to credential. Guys, this is the difference between real credentialing and just putting your information on their website. So the first thing I want you to do is send that little request to join through their portal. But here's the key to it that a lot of people don't know. I need you to do direct credentialing directly through the insurance company with submitting a LOI. Guys, every time you credential, I need you to have a LOI. Y'all, that's a letter of intent.
Okay.
Let these insurance companies know about your agency. What do you intend? What services do you intend to provide? What areas do you cover? A lot of people tell me, well, you know, I done went with another company before and I paid them my money, Queen. And it's been 3 years, I ain't heard nothing. I said, well, I can tell you right now, they're not doing direct credentialing. What they're doing is going to a portal, Availity. They upload your documents. Guys, if you've ever tried to credential on your own, and I know some of y'all over there laughing right now because you have, that is a document holder. That's a placeholder. That's not a credentialing. That's not the insurance company. That's where insurance company go and they pull your information during the second phase. It's phases to credentialing. It's phases. All right.
I hope y'all taking notes out there. The Queen is dropping some nuggets today.
Baby, I'm doing it. And normally I don't drop these nuggets. But
For
you know
free.
what? Tell them one more time.
For free.
All right. Because
listen, share this live. Call in. Ask questions. We want to hear from you because she's giving all the tea at her high tea show.
At my high tea
Again,
show.
it's 214-556-6239. Queen, keep spilling it for us today.
Okay, so look, here we go. So, guys, what you have to do to do direct credentialing to get your agency looked at is do that letter. Every insurance company has a credentialing department. Boy, let me tell you, some people mad at me right now. You know all my people that be outside looking in. Mm-hmm. They don't want me to tell y'all because, see, they've been overcharging y'all, and that's that quick hustle. Every day I'm hustling.
So y'all overcharging you, but you don't want to make $85 on the patient.
Let me tell you something. Boy, these coaches, trainers, and gurus. Y'all, let me tell y'all, United Kingdom, rock with your queen. I'm going to get y'all together. So what I want you guys to do, honestly, create you a letter of intent. You need to make these insurance companies want to do business with you. There's a lot of agencies that are licensed in every state. So, and from what I hear all the time from my clients and people that call me, because if you notice, the name of our company is what? Priority Consulting and Credentialing Services. Y'all, I'm a beast in this industry. You see what I'm saying? And in order to become a beast, you have to be very diversified. That's why I wanted to do this segment about credentialing, Derek, because a lot of people think it's just clicking that button and it's more to it. Because if you send your letter of intent directly to the credentialing department, you may have to call and ask provider services for a direct email. Send that LOI via email. That's the first step.
Mm-hmm.
First step. Click the button. through their portal and then create you a LOI. Make me want to do business with you. See, like, my letter would look something like this. Good morning. My name is Queen with Priority Home Care. And we have been in business for 3+ years, and I service Harris County, Galveston County, Orange County, Beaumont County, San Antonio, Texas. See, I'm gonna throw them all out there. And we provide non-medical and medical services with a specialty in IV therapy. See, I'm gonna throw something that ain't nobody else doing, and or if I'm a psych agency that can provide psych, I'm going to throw those are triggers to let them know that I'm a beast in this game. And then it's gonna click and say, wait a minute, this is a full-fledged service, this is a full-fledged agency. They've caught my attention. We're in the end of the quarter. When it comes down to credentialing, a lot of insurance companies, guys, they close their network on us. Whenever I see a network close and then they come back and they open for open enrollment, you got to take advantage of it. We have, at the end of this segment today, Derek, we are announcing that even if people call in and they can't get through the phone lines, we're going to do the segment of questions and answers with the Queen.
Yeah.
I know I'm looking at the emails right now, guys. I see you guys are starting to email questions. If you can call in. Let's talk about it live.
Again, 214-556-6239. TikTok, I haven't forgot about you. I put that number on your TikTok as well. So call in. We want to hear from you.
And I need y'all to call in. Y'all are listening. Call in and let me know if you understand and where I'm coming from this morning about this credentialing. And guys, the time frame to credential, I tell all clients now, it's not going to be fast. Depending on the insurance carrier, it may take up to a year and or beyond. Okay, there's certain things you have to have in place as a licensed agency and or facility in order to be credentialed. Now I'm going to throw this out for my MDs, for my medical doctors, for my family nurse practitioners, for facilities. If you are wanting to credential your facility and you have multiple physicians working underneath that bracket, see, we have to get the facility credentialed first. And then I need to get my FMPs and my doctors that's going to be touching my patients underneath that roof. Everybody needs to be credentialed underneath that facility, and that's called group credentialing. So then any patient that comes in, we can bill, the group can bill, and the facility can get paid as well for that patient coming into that door. Okay, see, it's levels to this credentialing. It's levels to it, and I need y'all to understand it doesn't happen overnight. But I'm willing to give it to you and lay the foundation because I want you guys to understand. I need you guys to be diverse because without diversification, your agency is not going to grow. And I think my producer just notified me we do have a call. So, Derek, I'm going to let you bring them on in.
Yes. Who's on the call with the Queen today?
This is Kiki B, RN from Tickety Talk, Queen.
Good morning, Miss Kiki. How you doing? Y'all, when she on my Tickety Talk, Derek, what I know that Drake song, I say, what's up, Kiki?
Kiki, did you just post a question on the Facebook as well?
I did, and then I decided I'd call in and ask it.
Yeah, great. I just saw your question. I was about to tell the Queen. Go ahead.
So I was wondering if there was any instance where non-medical care would be covered by Medicare.
No, ma'am. It's this that simple. And let me explain to you how non-medical care works. Non-medical is paid through every state's Medicaid. Medicare is considered medical. Now, the only other term that I can equate non-medical to, but it's really under the skilled side within our industry, it's home health aid services, HHA. But Medicare pays for HHA, but that's considered a skilled services, and it has to be overseen by a RN. That's the only time that Medicare will pay for a non-skilled service. But it's categorized as skill through Medicare's eyes because it's overseen by an RN. And you cannot, on the skill side, see a patient just for home health aid services and bill Medicare. It has to be an underlying diagnosis and a skill inside the home in order for home health aid to be valid. You cannot just go into a home for home health aid and there's no skilled nurse attached, no therapy attached. Does that make sense, Kiki?
Absolutely. Thank you so very much.
No, thank you for calling in. And Kiki, you got your ticket to the conference, girl.
Yes, ma'am.
I can't wait to see you in March. Thank you for calling in. Very good question. I answered it for Kiki. You can too get an answer. All you have to do is call us at
214-556-6239. And Queen, I got to give a shout out.
Okay, let's go.
You have a VIP guest watching the Facebook Live right now.
Who is my VIP guest?
As you guys know, the Queen and I, we work together, but we're also related. We're cousins. You have your great aunt, Margie, watching your Facebook Live.
Well, y'all know I got to take a pause for the calls. Anytime Queen has somebody. Y'all, this is
We
one of
see
the,
you. We see you.
This is one of my matriarchs of the Johnson and the clan
Yes.
and the Clemens clan. Auntie, thank you for tuning in. I love you so much,
We
y'all.
love you so much.
We love you, y'all. Let me
The
tell you, there ain't nothing
support.
like family support. And I am the queen within the family. But y'all, to them, I'm not the queen. I'm Lil Tina. Y'all, that's what she say. That's what she
Yes.
She said that's my baby. So, Auntie, thank you for tuning in.
Yes.
And I love you, and
I
I'll
just have
see
to
you
give that
soon.
shout out.
That's
Yeah.
a good shout out. I
Yeah.
think we have a call on the line.
Who do we have with the Queen today?
Hi guys.
Hey.
Jay Ken.
Oh, J. Ken.
What's going on, Jay Ken?
How are y'all?
I'm doing wonderful, wonderful. Jay Ken is from Indy, you guys. That's one of my clients. Jay Ken, what's going on in Indy, and what can we help you with?
Oh, honey. So I'm not going to talk about everybody else. It's a mess. I want to ask you about you were talking about the credentialing with the insurances.
Okay.
And I need to know how to go about doing that. Or better yet, how can you help me do that?
Okay, so let me tell you about Indiana. Indiana is one of those states, guys, and every state has different rules to credentialing. Fortunately, Indiana is one of those states, once you get approved for Medicaid, they automatically put you into a couple of their Medicaid MCOs automatically. Jay Candy, were you aware of that?
I don't think I really
Okay.
knew that, but I thought it was just like once you do the Medicaid, then you just with that.
Yeah, that's what happens. Your state has a couple of Medicaid Advantage plans that they automatically kind of put you in, but there is another step that you have to do to tie it in to let that insurance company know that you want to be directly credentialed through them so you can see all sides of their clients. So definitely that's something I can help you with. And I'm going to go ahead and make an announcement since we're talking about this. I was not going to announce it to the end of the show. But I'm giving the basics because, guys, we only on here for a short period of time. So I got a little surprise that I was going to tell y'all. That's why I wanted to do this. I want you guys to know how to properly credential on your own. Now, yes, Priority Consulting can do it for you. Everybody has been bugging me since I've been on social media about these doggone how-to books. You know, I didn't want to follow in the trend of the people, giving y'all a book for $99.99. Didn't want to do that. But guys, I'm giving you nuggets today on the credentialing process. What we are going to offer at Priority Consulting, Derek, because I don't even think I ran it by you, what we're going to offer for credentialing, because these are the basics. Y'all gonna have to wait and see. Okay, so look, we're gonna get to the end and then I'm gonna tell y'all, Jay, again, I see you soon. I hope I answered your question. And yes, you in the right hands, y'all. This is one of my lovely clients anyway. She knows she in the game. So, Jay Ken, free up that line so somebody else can come in. Jay Ken has
Free
my
the
person.
line.
Free the line. Jay Ken, I got you, girl. Thank you for calling in. As always, I appreciate you.
We love you. Happy holidays.
All right. Okay, so guys, are we going to take a commercial break, or you want me to jump back in this thing? Because I'm ready to go. I got something else I got to tell them. We got another call.
Before that, what do we have coming up in March? Because we need you to come out here.
We do. Guys, I am doing it's called the One Woman Show Healthcare Symposium, March 14th through the 16th in D-Town. Guys, that's Dallas, Texas.
Man.
Guys, our conference is going to be all about educating and elevating. If you've ever wanted to know what it takes to really get in to the industry, home care, home health, assisted living, group homes, behavioral health facilities, we are going from the bottom to the top when it comes down to this industry at this conference. Center for Medicare and Medicaid Services is confirmed. Guys, the people that pay us is going to be presenting. Derek, I don't know what else to do to tell these people this is the conference to be at. And the rate, y'all, I've been telling y'all.
What's the rate?
Only $649 for the entire weekend.
Until what date? Because it's going up, right?
December 31st, guys. I have been pre-selling since October 15th through December 31st since people got money. The people with the money, if y'all want to wait till January 1st, the tickets go to regular price, $899.
Y'all need to buy it now.
Guys, let me explain something to you. This is not a pressure sale. Because y'all know I know my stuff. I'm a certified healthcare consultant. Center for Medicare and Medicaid Services alone presenting should be enough for you if you are true about this industry and want to learn how to get into it. This is enough for you to get a ticket. Guys, these are your main payer sources. I am your keynote, and I'm a beast in the industry. And we have other special guests. The director of Anthem, we talking about credentialing, United Healthcare, Blue Cross Blue Shield, Humana. She gonna grace the stage. She's going to grace the stage with me. So, guys, it doesn't make sense. This is for beginners. This is for people that are not licensed. I would prefer a not licensed person to come to this conference before you even jump into the industry to make sure this is what you really want to do. Because it's going to be one of two things happen. I say it all the time on social media. Either you're going to be ready to go or you're going to be ready to stop, because this industry ain't for everybody. So,
wow, that's great. We're gonna take this call. We have a caller on the line, and then Queen, after the call, tell them how they can register for the conference as well.
I will. Go ahead.
Hello.
Who do we have on the call today?
Hi, this is Siobhan. So I have a quick question. So my husband has been telling me he wanted to start a group home. So I'm thinking, since I'm a licensed home health, I want to know if that could go on in my name, especially if it could go on in my name, or he would have to start everything from scratch by himself.
Good morning, Ms. Siobhan. Thank you for calling in. A group home has nothing to do with the home health agency license in the state of Texas, sweetie. That's going to be a totally different entity. You cannot group those. You are already a licensed home health agency. So you're going to have to he's going to have to start another company for a group home. And even if you could, that is not what I would recommend, because when you deal with state and federal funds, if you could, in the world of Texas, add that to your license, why would you? Because when an audit comes, because it will come, and Medicaid has frozen your funds, they're not looking at the services they're freezing, they're looking at the license. So everything that you have coming in would be froze at that time. So no, we don't group. I teach a class about not ever putting all your eggs in one basket when it comes down to this industry. So did that clarify it for you?
Yes, thank you so much.
No, thank you for calling in. I appreciate you. Happy holidays.
Thank you.
All right, and then guys, Derek had asked me to talk about registration.
Yeah, how can they register for this conference?
All you guys have to do to register is email my company at thehomehealthqueen@gmail.com. right? Yeah. thehomehealthqueen@gmail.com.
And have a website.
And the website. Guys, if you want to go check out the lineup, go check out my conference website. It is the Home Health Queen Conferences with an S.com. Guys, it's all laid out for you in black and white. My lineup is a beast. And somebody asked me one day, Queen, why you name your show your conference the One Woman Show Healthcare Symposium? And I tell them all the time, y'all know I'm cocky with it, because I have so much game. I have so much education and elevation in this industry. If I had to take that stage for 2 days by myself, I could handle it. But I will be selfish not to allow the people that pay a Center for Medicare and Medicaid Services, Anthem, I will be selfish not to invite them, and they've accepted my invitation because I do have the credentials to do so. I think, is that another call?
Was it? No.
Okay.
But there's someone on TikTok that had a question.
All right, let's go.
Okay, I'm going to read this. They have 3 lines they wrote.
Okay.
It says, what if it takes, I think they had a typo, what if it takes the insurance company a year and you need to play?
No, this is what I think they're trying to say.
You
want
need
to
to
know.
place the invoice. I think that's
Right.
what they're
No.
trying to say.
First off, you are not going to take any patients underneath, I don't care what insurance it is, without having a contract. Because this is the thing. You guys jump out. This is what I try to tell my clients. Sometimes we got to slow down and be patient. If you accept a patient and you know that you don't have a direct contract with that insurance company and you began to service that patient, you're not going to get paid. Just because you're in the middle of the credentialing process does not mean you are contracted. Because at the end of the day, that application has to go to board. Board in most insurance companies meet twice a year. And they have to make the final decision whether you're going to be accepted and or denied out. So until you get that full countersigned contract from these insurance companies with an effective date, you will not touch them patients. Okay? I always tell people, clients, do not start marketing for these insurance groups until you have a direct contract. Now, word to the wise. You can always market for PPO plans because mostly every PPO plan have an out-of-network benefit. Now, we almost at the end of the year. Mostly all patients have met their deductibles for 2024. Come January 1, if y'all gonna rock these PPOs, everybody deductibles start over. So guess what? Your claims are not gonna be paid. And typically, out-of-network is going to pay you anywhere from 75% up to 100%, some 55%. You're not going to get any monies as an out-of-network provider on a PPO claim until that patient pays their deductible. There's something called a co-insurance. Y'all have got to educate yourself in this industry about insurance so you can understand once a deductible is met. If a patient had a deductible for $3,000, and you accepted this patient as an out-of-network provider. Say you do 10 skilled nursing visits at $3,000. When your biller goes to bill that claim, if that deductible is not met, you're going to get a cute check. It's not even worth the paper is print on because it's going to say $0.00 payable to the provider because you just ate that deductible up. All right? So I hope y'all understand this. I'm going to keep educating y'all in this. And then what we going to do,
we're going to take a quick break, and then when we come back, we're going to dive into those questions that people emailed you about.
All right, we're going to do that because we're going to introduce that new segment, Questions with the Queen via email.
Questions with the Queen.
All right, then, y'all. Well, we're finna take a quick break. Let me just do what I always do, and I'll be back. Y'all continue to watch, follow, like, share, comment, and get your phones ready.
Again, 214-556-6239. We still got time to hear from you. All right? Peace. What's up? What's up? What's up? We are back, and now we have a new segment called Questions with the Queen. All right.
All right, all
So
right,
we
all
had
right.
some
I
people
love it.
email the Queen with some questions, and we're going to dive into those questions right now.
Now, are they going to be able to call in too?
They can call in as well.
So-
214-556-6239. We have a person, Mrs. Hunter from Florida. She said that she is interested in owning an ALF or group home.
Okay.
She said she was also interested in urgent care,
Okay.
but she saw that you mentioned you have to have a MD. But her goal is really to help people. She loves helping people. She's a CNA at night and a dental assistant during the day. She's a hustler.
Oh, every day I'm hustling. I love them. I love them. Okay, first off, thank you for the question. What was her name again?
Naisha Hunter.
Hello, Miss Naisha. Thank you for
Florida.
sending your question in all the way from Florida. Naisha, just to let you know, listening to your background, a CNA, a dental assistant, you have what it takes to get into this industry. What I want you to do is start thinking about what better suits you, because I think right now you have a lot of different areas. I would not worry about an urgent care because your credentials at this moment of what you've expressed to us, you won't have the proper credentials in order to do an urgent care clinic. So then that leads me to believe your other areas of interest were facilities, urgent care. You are a CNA, professional opinion. You need to think about owning your very own non-medical home care agency. You are used to dealing with the patients in the field and or facility, and you are used to dealing with people to help them with their ADLs. So I don't want to remove you from that comfort zone, because that would be the quickest business within the industry, because you hold the credentials to do so in Florida. ACA is your website for Florida. Go to ACA, and I want you to pull the credentials needed and required, the rules and regulations to start a home care agency in Florida. And I want you to look at those rules and regulations, and I even want you to look at the application so you can educate yourself on the background qualifications needed. And it will also tell you exactly what it takes to open that agency in Florida. So I hope I hit on all points of your question. Did I miss anything?
I think you were good.
Okay, all right.
Email us if you have more.
Email us at thehomehealthqueen@gmail.com. Come on, who I have?
Now we have Angela in Arkansas, our next door neighbor.
Okay.
All right. She said, we are a newly licensed agency in Arkansas for personal care services statewide.
Okay.
Still awaiting a care attendant care approvals. She submitted a hardship letter and documentations to waive the fee of $568 for each. She's trying to figure out the next steps. Please help.
Okay, all right. So that's a three-part question. First off, congratulations. She did say that she's a newly licensed agency, correct?
Correct.
In Arkansas, correct?
Correct.
Okay, and so basically, if you are a newly licensed agency in Arkansas, the first thing I need you to do is go ahead and apply for your state's Medicaid program. Now, as far as your care attendants, I'm assuming, that's why I like them to call in, because sometimes the questions are not very clear. I'm assuming you're asking about their background checks and qualifications before you can hire them. I really need to see the way that's written, Derek, because it's kind of fuzzy on her question. But if you are, yes, you have to start hiring your attendants. Okay, but my question for you is, you can't start hiring attendants if you're not credentialed from either your Medicaid or have a waiver program put in place, and unless you are solely private pay. So I really need some more information to help that young lady, because that question is not very clear. If you are on social media right now, let Derek know so I can give you proper clarification. But I think what she's saying is somebody submitted a hardship letter so they don't have to pay for that background check, and then the state would waive the fee to get all their credentials ran. So if that's the case, there's nothing you can do but wait for them to accept and approve that hardship to move forward. Do not put an employee in your agency until they're fully background checked, okay? All right.
All right.
Okay.
We have someone all the way from Georgia.
Okay.
All right. Miss Gibson, hello. Have you helped people get licenses in the state of Georgia?
Absolutely. What's her name again?
Miss Gibson.
Miss Gibson, are you on my Tickety Talk? Y'all show your face if
She
you're on Tickety
is.
Talk. All right then, girl. Let me tell you something. You are new to my live. Miss Gibson, I am certified in all 50 states to help people start and maintain, whether it's a non-medical agency, a licensed home health agency, assisted living facility, behavioral health facilities, and much more. My team, we have offices all throughout the state of Texas and now in Florida. And so to answer your question, absolutely, this is what we do. I just left Florida from doing a Laying the Foundation with Documentation training course. Not Florida, I just left Atlanta. We left Atlanta last month, and I have clients all throughout Atlanta. And here I go. I got to be a little shady. We don't just do non-medical, girl. We do it all. So all you have to do to get a consultation with me is email my team at thehomehealthqueen@gmail.com. Guys, when I say I'm worldwide and certified, I mean that. I have the credentials, and I'm very fluent in all 50 states when it comes down to rules and regulations and running these companies. Guys, I say it all the time. Anybody can get you a license, and that's why I'm doing what I do now, because these people are out here getting y'all these licenses, charging y'all an arm, a leg, your granddaughter, and a son and or daughter. And you get these licenses, and then you become stuck because when the state pop in or send you a letter that they're coming, that's Medicaid is the only state's entity that will tell you, okay, for their first site office visit. Y'all, that's light work. Don't get nervous. But these so-called coaches, trainers, gurus, seeing to all my people in other countries, be mindful of this. It takes more to run an agency. Getting a license is easy. So celebrate that piece of paper because that's all it is to me. But then you need to come to a real certified healthcare consultant and let me help you lay the foundation for longevity.
I have another good question from TikTok.
Let's go.
As a new home health care agency, are we able to apply for loans in order to become a provider with DOA?
Okay, you can apply for any loans that you would like within your industry. It doesn't matter if it's home health, home care, assisted living. But let me just go ahead and tell you a little disheartening news. You have entered into the field of home health and home care, which is the highest rated field for healthcare fraud. So in order to get a loan through any private banking entity, you have to really, really go in there and have the amount of money that you're trying to get that loan for in your own personal account, because soon as they see your industry, unfortunately, they've already labeled you as a potential threat because of the industry that we're in, and then you become high risk, and the loans are 9 times out of 10 not going to be approved. Okay, so you have to already be established in order to do this. Okay, so if you're already established and you have enough collateral, then your chances are far greater for asking for loans in this industry. And I hate that because we're judged before we could even get off the ground. And that's why it's very important. Y'all need to come to my conference because I am going to have a financial person there from a banking entity talking about the best way to go at trying to get some outside funds. And a lot of people ask me about grants, Derek, and this is what I tell them about a grant. Well, if you could get one, get one. But I'm going to tell you like this, when you get a grant, that means you have everybody looking at everything you're doing financially. So get prepared and make sure that you prepared for that grant, for the rules and regulations of that grant, stacked on top of the rules and regulations to run this agency. And here's another myth. Y'all stop setting these agencies up as not for profit. A home health, home care should be, all right? All right. Another thing is, I need y'all, I know you really want to be in this industry, Derek, and a lot of clients always look for other options. Guys, be aware there are people out here, and I'm going to say what the streets call them. They call them longshoremen. I'm going to say what back in the day they used to call themselves. What is it? Baby shark. Y'all, don't be so desperate and so wanting to get into this industry that bad. I know right now, guys, there's a young lady out of Florida. I'm not going to say her name, but she calls herself a coach. And they have this thing going where she has partnered with someone. I'm going to call him him, her, a loan shark. Yeah, I'm going to go on and say it. And what they're doing is telling you, if you want to own a home care, come to me. Come to coach. Because I have somebody that'll give you your money based. It don't matter about your credit because they going to believe in you. But I'm going to get you a loan anywhere from 20,000 to 100 G's.
Wow.
But that money come to me. And I'm going to help you get this non-medical agency. So y'all just done signed up with this loan shark at a 50, 100,000, but the money going to the so-called coach for her to get y'all a non-license, and then y'all stuck with that loan for the rest of your life on top. But then this is what they tell them. You can't do nothing. Yeah, I got you a license. My nephew can get you that license. So be mindful. Don't be so desperate to jump into this industry without being cautious of the industry. So that's what I told y'all I'm going to always speak truth. I'm going to always speak facts when it comes down to my industry because that's what's most important to me. That's why I'm doing this podcast. That's why I'm doing social media. And y'all be helping me. My nieces be helping me on social media. I thank y'all.
All right, we have one more call. Time is running out, but we have one more call. We're going to take this call real quick.
Let's go. I'm always ready.
Who do we have with the queen today?
Denise.
Hello, Denise. Where are you calling from?
Hi. I'm calling from Maryland.
Nice, Maryland.
Hello, Miss Denise. Welcome to our podcast. This is Queen, my love. How can I help you?
Okay, I take care of my elderly mother for 2 years now.
Okay.
Took her out of a nursing home during the pandemic, 2022. She's been denied the waiver. So what I did, I had to quit my job after 20-some years. I updated my home into assisted living. I will be getting my license by January. Now, since I've been denied the waiver for 2 years, my mother's stroke and dementia, I take care of her solely on my own. I need 24/7 care for my mother by myself, and I've been denied the waiver. Do you think once I get my license that I will be able to get the waiver for her? And the reason I was denied the waiver for 2 years is because during the pandemic, when people were, leaving, I got an insurance policy for her in 2021 for my mother in case she left. And the waiver, Medicaid, they're using that against me. The state's using that against me of an income that I cannot retrieve. She cannot retrieve. My mother can't walk, sit up, anything. They have used that against me since 2022 when I brought her into my home to leave instead of the nursing home. So do you think once I get my license that they will then approve me to get the waiver so I can get some help before I lose my home that I've been out of work since last December?
Okay.
Taking care of her on my own, 24/7 with no state assistance whatsoever, just her Social Security. And I took all of my funds that I've saved over the years and put it into updating my home for assisted living. It's ready to go. I'm waiting on fire marshals, and then I will get the state to come in and do what they do.
Okay. All right. Okay. Denise, I'm going to give you a long story short. Long story short, when you apply for that waiver, you apply for that waiver underneath a individual, correct?
My mother.
Your mother, exactly. Once you become a licensed facility, you have to get credentialed in order to take waiver program clients. Your mother is getting denied because of that insurance that you took out on her. So what we'll have to do, I want you to email me at thehomehealthqueen@gmail.com, and I'm going to shoot you some very important information on possibilities of getting her approved for that waiver program, okay? Because there is a way to do it, but because you've done it twice, you got to be careful about it, okay?
Okay.
Well, thank you for calling in. I appreciate you. Y'all, we got to begin to wrap up because that is our time.
We got to go.
We got to go. Y'all, we got to go. We have so much fun, but before we go, I got to drop this. Guys, I am going to be dropping a more in detail, what are we calling that book again? I forgot. I'm sorry. My credentialing.
She'll tell you next week.
No, I want to tell the people now. The credentialing book. Guys, I'm going to give y'all a guide to credentialing for $49. And if you are interested, all you have to do is email me at thehomehealthqueen.com. I'll talk to y'all next week, same place, same time.
Thank you so much. Peace.
Hey, this is the Queen, host of the Home Health Queen High Tea Show, broadcasting live each week on Saturday at 11 a.m. Central Time from the Fishbowl Radio Network studios in Bedford, Texas. Log on to hear all things home care and home health. Listen in to get all the tea because I'm going to bring it to you, whether it's home health, hospice, assisted living, and much more. So be sure to log on each week on Saturdays at 11 a.m. Central Time. Catch the Queen on the Home Health Queen High Tea Show. Peace.